The adverse effects for these drugs, all of them have a little bit of fatigue, no matter which one it is. Darolutamide may have a little bit less, but in the real world, it's hard to say if that really is going to make a difference. They all have the risk of hot flashes for men, which men do not like. They all have the risk of like hypertension, headache. Some of the unusual things that each one has, all of them have a risk of rash, although in the research we saw it a little bit more with apalutamide, and it was brought out that it usually occurred around the 83rd day median, and we could treat it with just steroids, topical steroids, antihistamines. Very few of them had to have prednisone or anything oral for the rash. The other thing with apalutamide is we have to watch for hypothyroidism. For patients that already have it, they may have to have their medications adjusted. For patients that don't have it, you need to be watching for it because we may be attributing their fatigue to the drug when actually their thyroid is underactive. So that is some of the differences between the different drugs that you have to be aware of. Some more differences include some lab values that you may see changed. So with darolutamide, you may see an increase in the AST and bilirubin levels, and you may see a little bit decrease in the neutrophil count. With apalutamide, you might also see some elevation in their triglycerides in addition to sometimes a low white blood cell count too, or lower white blood cell count. I shouldn't say it gets really low, but yes. With enzalutamide, some of the lab values that you can see increased are you can see an increase in their glucose levels, you can see an increase in their magnesium levels, you can have some hyponatremia, and you can also have some decrease in their neutrophil count also.